Captain Shavonne Smith, flight nurse, assigned to the 10th EAEF. Shavonne, S-H-A-V-O-N-N-E, Smith, S-M-I-T-H. So we are an air medical evacuation crew, and we're tasked with evacuating patients outside of areas to higher levels of care that they can receive at specific hospitals. So we're part of an air medical evacuation crew, and we're tasked with evacuating injured personnel to levels of care capable of taking care of their needs and injuries. So medical capabilities are very important to any operation, and so that if any personnel, U.S. military or any of our allies are injured, we can respond and assist them, and so that they can recover and keep doing their jobs. So once we get alerted that there is a mission or that we're needed to transport personnel, we participate in a crew brief and load our equipment, and then we bring it to the aircraft. And so once we arrive at the aircraft, there are a number of things that we take off and we load in these stanchions that you see here. We set up stanchions that can hold our equipment, our medical equipment, and then we also set up our spaces, our litter spaces, to accommodate our patients. Military personnel can perform their jobs and their duties with the confidence in knowing that there are medical personnel out here and ready to assist them as need be. This aircraft also comes with built-in oxygen systems, and so we are able to provide therapeutic oxygen to our patients that require oxygen while in flight. We also have electrical capabilities, and so that all our medical equipment can run off electrical power during flight. If patients are in austere environments or forward deployed, and they have to get transported from one location to another location capable of providing that level of care, then they would use an air evacuation medical crew to perform those duties. So you have medical personnel on the ground that may pick up patients from point of injury and transfer them to a smaller facility capable of providing some care, but they may require more extensive care, and that's when the aircrafts come into place and transport those patients. For example, patients injured in Kabul most recently, you would have to use aircrafts to transport those patients to a hospital type of facility capable of conducting care for those patients for days or weeks as required. You have patients that have gunshot wounds, patients that have been in IED blasts, patients that are pregnant, patients that are experiencing respiratory or cardiac emergencies. Any type of medical emergency that you would typically see in a hospital, we will see added with the component of trauma emergencies. So I am a flight nurse, and so a part of our air medical evacuation crew, the standard crew has 2 flight nurses and 3 air medical evacuation technicians. We are assigned to making sure that the mission runs smoothly, taking care of our patients, and making sure that they get the best care.